You don't think that'll work?
No.
Are we on? Hey, good morning, everybody. Happy rainy day.
And here you go.
Thanks, Tyler.
Yeah, figured it was better to swing around beforehand.
Fancy.
I made it back to this side of the glass on time too. I don't know how I did it.
This good?
Fine.
Good morning, everybody. Welcome to Intellectual Medicine. It's Dr. Petteruti along with Shannon on a beautiful October day here in New England. Special show today, Shannon. We've got some exciting things on tap. Dr. David Lowell is going to be a call-in guest. He's a good friend and colleague, one of the state's foremost infectious disease experts, and he's going to give us his opinion on an important question to many of our patients out there. Should I or should I not get the flu shot? What are the risks and benefits? And, we may even tap into his expertise, Shannon, for his knowledge about the shingles immunization. Is this worth getting or not? And the whole concept of immunizations in general and immune function in general, something that we can touch upon. Well, I was at a football game last night, watching high school football, one of my joys in life, and somebody asked me a question that I thought was compelling. He said, of all the things you do in intellectual medicine, of all the anti-aging modalities, what's the big breakthrough? We talk about IM 120, this whole concept, the aspiration, the hope, and building a life towards 120-year lifespan. Now, some have criticized us for being so bold as to affirm such a objective goal. And I refute that criticism in this manner. You cannot achieve anything in life without a goal being established. And the goal should be one that is plausible, but also challenging. So I think that sums up a lot of where we are, Shan, with the 120-year lifespan objective. If we said you could possibly live to be 100, that would be self-evident. People do that. More people are living to 100 than ever before. However, when you build these pieces together, so back to the question, what's the big breakthrough? The answer is that there will not be a singular eureka moment where we get the pill or the shot or the treatment that blows up lifespan to 200. That may occur, but it's more likely to be elemental. So you think about that, and I answer the question thusly. The bioidentical hormone revolution is profoundly affecting how people age. Unfortunately, its introduction into the mainstream is being stifled by misinformation and by a momentum of the status quo. The momentum of the status quo is a powerful force. We see it at play every day in our lives, don't we? Why are things the way they are? Shouldn't we be better than this? Can't things be different? Why has your visit to your family doctor been effectively unchanged in the past 30 years? Where are all these scientific breakthroughs in my life right now? I'm tired of reading about them in the newspaper, in articles, and going in to see my doctor and having the same routine outlined for me. An interesting thing has occurred as doctors have lost control of medicine. It's become bureaucratic. And now everything is a flow chart from the top down, right? We go into the doctor, you punch the ticket. And now they're mandating things in these visits, like you've got to inquire about seat belts and what sort of things are of late. Don't they have something in there about domestic violence that has to be annotated as well, Shannon? Are you aware of that as part of health screening? I remember there were certain, now these are all socially worthy objectives that have merit, but in the refined time span, how do you get to these advances? So bioidentical hormones. The fear factor is it's going to give you cancer or heart disease or both. Well, a consensus conference was gathered in Prog by many specialists across a range of different specialties. The objective to review all the evidence regarding testosterone treatment in men and discern where the risks and benefits were. The Prog conference, this was recent, within the last couple of years, came away with several fascinating takes, I thought. One, testosterone deficiency syndrome is not limited by age. Simply put, you can experience symptoms of fatigue, brain fog, libido dysfunction, muscle atrophy at any age, and they may be associated with testosterone deficiency syndrome. Another takeaway point, the blood test does not declare the presence or absence of the syndrome. That is, you can't look at the lab, and if the lab's normal, you eliminate consideration of that possibility. Testosterone is a pulsatile hormone. It occurs in surges, and it waxes and wanes over the course of the day, the week, and the month in response to stimuli in the environment. Therefore, you can't do one snapshot of it and say you're normal, you're not normal. You got to look at the whole picture. And by the way, everything I say about testosterone applies doubly for women with regard to its merit, its necessity for quality living, and for brain function. A couple other take-home points. There is no cumulative evidence to suggest testosterone increases cardiovascular risk, nor prostate cancer risk. And that this modality, this treatment, this changes now. This is, I'm done with the Prog study. I just wanted to highlight the absence of prostate cancer risk, the absence of heart disease risk, and the absence of a distinct blood test to declare its absence or presence. At Intellectual Medicine, our philosophy of anti-aging boldly asserts that you have two choices. You will either be on hormones or suffer the consequence. And with women, testosterone is woefully neglected. The study, the interest, and the application is far behind the need. Osteoporosis, cognitive impairment, dementia, even immune function decay can be correlated to hormone support. A new look at the Women's Health Initiative showed that there was no increased risk of breast cancer in women who are on estrogen, and the trend was towards a decreasing risk. The only consistent correlation regarding to hormones and breast cancer has been with artificial progesterone, the medroxyprogesterone, also known as Provera, which is a drug rarely used anymore by advanced doctors doing anti-aging therapies. So hormone support, yes. How about keeping your body weight perfect? Absolutely. How about getting rid of lead and other toxic heavy metals? You bet. And keeping your arteries fit? That's essential. So that you've built a platform, thus when the next breakthrough comes through, you'll be healthy enough to benefit from it. This is our philosophy of anti-aging medicine, that today we don't know what breakthrough is going to happen in the next 5, 10, 15, and 20 years. But we do know that if you're healthy, vital, and sharp of mind, you have a chance to take advantage of it. And that also includes avoiding the flu and what we call immunologic senescence, the fading of immune function as we age. When we come back, we're going to be talking about both of these issues. And by the time we're done today, we will help guide you towards your personal decision about flu shot, yes or no. Up next will be Dr. David Lowe. I'm Dr. Steve Petteruti. This is Intellectual Medicine. We'll be right back.
Joe, where is it?
What?
Joe is funny.
Hey, Joe.
He
Thanks
said,
for tuning in.
He said, can you comfort me after that, the loss at 3 a.m.?
Oh, yeah, we should be talking about sleep deprivation and immune health. 3 a.m. That
3:20.
Well, you know, here's the thing about being a Red Sox fan and watching the game happen until 3 a.m. Somewhere in Cleveland, they're wishing they were sleep deprived by watching the Indians in the postseason. It ain't going to happen, but we're there and they're not. So it'll be a memorable event. Occasional sporadic interruption of your sleep quality. It's an interesting thing. You know, maybe we'll query Dr. Lowe about that. But look, we all know this, right? If you knock out a night's sleep, you're going to not feel great the next day. But most people can get away with it. You can get away, if you're in pretty good health, you can get away with one night without quality sleep. So that's not horrible. The problem is the second night. You know, when I was a medical resident, we used to do 36-hour shifts as a routine. We'd be on call, up all night, work all the next day. What I noticed was that your mental acuity was pretty on. You could still remember facts. You could still prescribe medicines appropriately, but the empathy went out the window. Somebody came in pain, you just didn't give a crap anymore. You were so drained. And I think that's what happens. Yeah, that's a good reflection. Empathy in medicine is less available, it seems to me. And you guys can comment on this because you are the patients experiencing the effect. You have employees that are run down and beat up. They're not good at customer service. You have family docs and primary care that are run down and beat up. They start to lose an empathic capacity that can corrode that whole encounter with the patient, can affect their ability to listen. And if you're not listening, it's hard to process information, particularly information that's complex. You know, you go into your doc, you want to have a reflective conversation about the risks and benefits of the flu shot. That's a tough conversation. The time is constrained. They got to either act or not act, right? And there's just somebody out there keeping score. How many flu shots did you give out this month, this week? There is an institutional orthodox medicine dogma that heartily endorses flu shots as maybe the only or the best approach. Now, we're not against flu shots at Intellectual Medicine, but we are in favor of reflective decision making and freedom of individual choice. In my opinion, if a shot's good enough, we shouldn't need herd immunity where everybody needs to get a shot so that some people won't get sick. The idea of an immunization is to protect the individual. We're not an army. We're not being conscripted. So compulsory immunizations that are forced on us without our choice is something that needs to be done very judiciously. We may have time to talk about the human papillomavirus, Rhode Island being one of the only states in the nation that forces children to get this immunization, despite the fact that it's a sexually transmitted disease that cannot be communicated through cough, sneeze, or by air particles. Forced immunizations. Dangerous. For freedom. We're back. This is Dr. Steve Petteruti at Intellectual Medicine along with Shannon. Up next will be Dr. David Lowell, infectious disease specialist at Kent Hospital, a good friend, an intellectual colleague, a Renaissance man. He's published books, he has spoken on a wide range of topics. If you ever need Dr. Lowell's services, David, you know I love you, but this is a true statement. If you ever need Dr. Lowell, you've had a bad day, right? You've had a bad week. Because you're staring up at a hospital bed. I can tell you when I was doing hospital medicine, Dr. Lowe was a doctor's doctor. He's a guy that would come in when the patients were getting more ill and the complexity escalated. And David, thank you for your years of service and all the patients and doctors you've helped. And thanks for being on my show. But so we got to dive right into this. A lot of my listeners, Dave, are a little bit skeptical about flu shots. You know, we've all been hurt. We've all been taught that this is something that should be done. But there's a little bit of tell me about this year's flu shot, right? Because isn't this our best guess? We don't know if it's going to work. What's it looking like this year? Right. 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 So just to summarize, they study what's happening in Asia because what's happening there tends to predict what's going to happen here. Right. Right. So by March of 2018, they've got to have this dialed in because they have to make it in time to get it to market. And the challenge, as I understand it, with the viruses is that they can mutate and the prevailing strain can change, and consequently, it's certainly not 100% effective. That would be absurd. Nothing is. But tell us a little bit about this concept of what's called herd immunity. You know, everybody's encouraged to get immunized so that the society at large will be less likely to spread the flu around. Has that ever been proven to be the case? Right. 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 Yeah. Right. So people ask me this question a lot, you know, should I get the flu shot or not? And, you know, my impressions and my guidance is that if something is known not to cause you harm, that is, you can do it, you've done it in the past, it doesn't hurt you, and there's a possibility of benefit, well, the decision making shifts to the affirmative. You know, that is, I get my flu shot every year. I'm a doctor. I think doctors and healthcare providers are accountable to get a flu shot, so they diminish the risk of being a vector, that is, transmitting it to the sick patients that they see. If I'm John Q. Citizen and I'm 35 years old, I may not feel the need because I'm pretty resilient. But folks, if you're around old, sick, feeble people, their ability to mount a defense is really diminished, and it may be more incumbent upon folks in that circumstance. You've got an elderly parent living with you or whom you visit, to go ahead and take one for the team. But have you seen much negative effect from the flu shot? Do you get the opportunity to see these patients and talk to them about their historical response? Do you see many people saying, it gives me a cold, it gives me the flu? Right. 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 So we know the flu claims lives, not only lives of the elderly and the infirm, but tragically on occasion, the young and the healthy. Now we took 200 children last year was that proven influenza, or was that just influenza-like symptoms? Right. Right. So the flu can weaken your immune system and open the door for other bad things to happen. Yep. Right. Right. So repetitive exposure can build immunity. If you get a flu shot every year, year after year, is there any evidence that you're going to build up cumulative immunity and make you more resilient later in life? How long does a flu shot last for? So up to 3 months on the short end, up to a year at the long end. So you got to time the shot a little bit based on when the peak season's going to happen. If I get my flu shot in August, September, October, by November, it could be waning. David, have you had your flu shot yet? And are you going to get it boosted later in the year? Yeah. Where does that older folk line fall? I'm getting nervous about that. Is that around where the Denny's special happens? All right, but I want to define old age for the moment. What is old age for these boosters or the extra strong shot? Is there a line in the sand? All right, I'm good. I'm still young. I like it. Shannon, what about you? What's your yeah over? Hey, so I got Tyler behind the glass here. David, he's a young, healthy guy. Tyler, do you get a flu shot every year? You do. Yeah. All right. How about Dave? How about the drugs for flu? I'm very unimpressed. Let me color our conversation with my opinion first. That I'm very unimpressed by Tamiflu. I think it's an overhyped drug with very little merit. Tell me your thoughts. You've seen. Right. Right. So you kind of like you think the Tamiflu and drugs like that are worth the effort. Yeah. Now, look, I got to tell you though, the Cochrane review was not favorable. They said that there's no evidence of decreased hospitalization, no evidence of decreased death, and that the studies they criticized as being publication bias promoted by the company. The only thing they affirmed was maybe you're going to get 1 day less of symptom, but you got to take it within 24 hours of getting symptom. That takes you that long just to get through your doctor on the phone. You know. All right. Well, let's shift gears. I only got about a minute left, and before we depart, David, I want you to share with me the information about zinc because that was surprising to you. Yep. David, you're too smart to have on such a brief period of time. We got to have you come back. That's Dr. David Lowe. Dave, thanks for being with us. We're going to jump next from the Revolution Softwash News Center. It's the news with Doug Lizette. Doug, I hope you get your flu shot, my friend. That and don't forget the zinc, folks. We'll talk more about that after your news flashes. That's David Lowe, folks. Now, listen, many of you are not enamored of the conventional form of flu and the flu shot. But with something as difficult to treat as influenza, my risk benefit tilts towards endorsing it as long as you've had no negative effect from it. And here's the problem. And David Lowe is as I mentioned at the outset, he's a voice worth listening to. However, he only sees people that are sick and in the hospital, and there can be a little bit of an observation skew by virtue of that. We see people that will tell us, boy, I had that flu shot and I was sick for a week, or I had a headache, or I got flu-like symptoms and it was horrible. These are patients that the hospital doctors never see. And these are patients whose voices go unheard. There's something called the Vaccination Adverse Events Reporting System, or VAERS, VAERS. It's supposed to be a system where you can call up and report a negative effect. Good luck. You might as well open your door and shout out into the wind, I had a negative effect. There's a certain amount of self-validating refusal to accept information. That is, doctors don't believe that the flu shot causes any problems. If you report a problem and suspect it may be related to the flu shot, frequently the doctor rejects it out of hand. Well, you know, doctor, I had the flu shot and I was sick for 2 weeks, so that can't happen. Flu shot it had to be a coincidence. So that really stymies insight. You know, despite these limitations, however, I think the shot may have merit. Now, when we get back, we'll talk a little bit about the shingles immunization, the Zostavax, and there's a newer one out that's supposedly more effective, but it had a significant rate of side effects to the point where people lost 2 to 3 days of functional quality of life because of the immunization. So we'll touch on that. But the thing that when you get somebody like Dr. David Lowe, who is a bugs and drugs expert, who is a brilliant but very engaged in orthodox medicine, as well he should be. I'm not criticizing that. It's just the way he helps people. His focus is in that arena. It's not in the arena of nutraceuticals and vitamins. That's a fund of knowledge that is separate and parallel. But even in that arena, the zinc at 50 milligrams, no harm. No harm. You start to get an upper respiratory infection, a cold, a sniffle, the risk of zinc is extraordinarily low. The side effects are minor should they occur. And like Dr. Lowe said, you get this over the counter. Keep it in your medicine cabinet so that when you start to feel an illness, boom, you hit it right away. We advocate combining that with vitamin C. Vitamin C in studies that you got to go higher dose though, folks. 2,000 milligrams twice a day, up to 8,000 milligrams a day. The only issue there is gastrointestinal tolerance. So I think you should keep this on your medicine cabinet. And at the first sign, right, sinus infection, most sinus infections, over 90% of them, are viruses. Antibiotics don't help that. But they can lead, you could start out with a cold, a head cold, have it lead into a bacterial infection because your immune system's now weakened. And that's what Dr. Lowe is talking about, the bacterial on top of viral phenomenon. So you do things early on, the minute the symptom starts. Particularly, that'll cause no harm. I still don't like Tamiflu, despite Dr. Lowe's endorsement of it. The side effects are extraordinarily high. The benefit is minuscule. And the ability to acquire it in a timely fashion is practically not available. I mean, how many of you can pick up the phone and get in to see your doctor within the next 12 hours? Yeah, I didn't think so. And by the time you get in there, yeah, come in tomorrow. Yeah, come in. So the ship's already left the station. So it's just a ineffective drug, in my view, that's not worth the effort. We advocate high-dose intravenous vitamin C. It is certainly not FDA approved to treat viral infection, but you look at that mechanism of action. They did studies looking at the high-dose vitamin C in shingles, and they found a decrease in symptoms across the board and a decreased risk of post-herpetic neuralgias. So tonight, the Red Sox are going to win. Is Osvaldi pitching? Anybody know? I predict a win for the Red Sox. I think they're too good to lose back-to-back. Los Angeles isn't that good. All right, Los Angeles is pretty good. But I think the Sox win. Patriots, really? Monday night in Buffalo? That's a layup drill. They're going to win that game. And most importantly, Thursday night, the flag football team that I coach, we are a juggernaut headed to a Super Bowl victory.
Evaldi pitched 6 innings. Evaldi, is that his name?
Evaldi, yeah.
6 innings last night.
Oh, he did 6 innings last night.
Oh, wow.
Yeah, that's too bad. That means he's unavailable. Means he's unavailable till, like, what are we, game 4? He probably won't be ready until game 6 back in Boston. Maybe they'll use him earlier.
6 inning, goodness. He can't handle 6
18. It's 18 innings.
That's a long game. 97 pitches for him.
Hey gang, we're back. It's Dr. Petteruti along with Shannon here on WPRO, the intellectual voice of Southern New England. We just heard from Dr. David Lowe giving his opinion regarding the value of the flu shot. And to summarize David's opinion, now David, it's a voice worth listening to, folks. He's been around a long time. He's deeply studied in a lot of orthodox medicine. He's an infectious disease specialist, and he's seen the worst of the flu. And his advocacy is that people should get a flu shot unless there's a compelling reason not to get it. That the flu shot may be only 40% effective, but it's 40% better than 0%. That the flu shot can reduce the severity of your illness, and that it may help protect against death from disease. All of these statements are certainly arguable. The science behind the flu shot is as good as we can make it, but the flu shot, the process by which we make the flu shot, is still a little bit crude. That is, a real good immunization is one that you can take and you don't have to have herd immunity in order to make it work. I will get my flu shot. Tyler gets his. I think you're on board with that, right, Ty? Ironically, the younger people get a better response. And if you've had the flu shot, we were talking off air a moment ago, Shannon and I, the tendency for doctors to ignore information that they've already decided isn't worth listening to extends to immunizations. And I've had many patients say to me, I had my flu shot and I felt horrible for a week.
I got to tell you, every year.
What's that?
I get sick from it every year.
Well, it's just a coincidence.
I know.
Shannon. It's
every
not the
year?
flu shot.
It's
no,
terrible.
it's just you. It's a placebo effect. You clearly have mental weaknesses that have. No, see, but here's the problem.
Right.
You talk to the doctor and tell them, look, every year I get my shot, I feel horrible. They're going to tell us not the flu shot.
Mm-hmm.
Not the flu shot. Can't be. Now, we had that experience with the human papillomavirus where our son had an awful adverse reaction, and we attempted to have the doctors report it to the immunization reporting service. They wouldn't do it.
No, pediatrician wouldn't do it, and the ER wouldn't do it.
Yeah.
No one would do it.
By the way, he lost vision and had a searing headache that required an emergency room visit and an MRI of his brain. But that wasn't enough.
But no.
No, it's okay.
No.
It's a coincidence. Coincidence. Couldn't be. If you don't open your mind to possibilities, you will never experience a new thought. But fortunately, Dr. Lowe affirmed his finding in the literature that we have also reported here, that high-dose zinc can abort and diminish and otherwise benefit viral infections. That's great news. Why? Because you can get it right over the counter. Why? Because viruses are not treated with antibiotics, people. Can we please stop taking Z-Packs for sinus infections or head colds? Antibiotic exposure damages your immune function, damages the bacteria in your gut, and that damage can linger for months. So you do not want to wade into antibiotics recklessly. Have you ever heard someone say this? I'm going to get that antibiotic just so I can nip it in the bud. I'm coughing and I don't want it to turn into pneumonia. So I'm going to start the antibiotic now. Zero value, people. That cough you have, unless you're a chronic lung patient, that cough you have is overwhelmingly a virus. It's going to last for 2 weeks. Whatever you do, it's going to linger. That's what coughs do. Zinc at 50 milligrams, high-dose vitamin C. You could do it orally, 2,000 twice a day. How about high-dose intravenous vitamin C to assist with viral infections? It's certainly unproven. It's not FDA approved, but there's growing research evidence of its effect on infections. In-hospital sepsis, which is a life-threatening infectious illness, the death rate in one study was reduced from 40% down to 8% in people who received intravenous vitamin C. And the most ill patients on death's door, this benign, cheap intervention reduced death from 40 to 8%. Why is this not standard of care nationwide? Why is vitamin C not in every hospital emergency room across America? It has to do with the petrification of thought, with a rejection of anything that's not born out of orthodoxy, anything not born out of the tertiary care centers, anything that is not flowing down the mountain of big pharma into their pockets. They also did studies looking at the endothelial effect of high-dose vitamin C in people that are having inflammatory responses. When you're sick, your body becomes inflamed. And they did a study, Shannon, where they induced an inflammatory state that correlated with increased arterial damage. And then they gave people high-dose intravenous vitamin C, and the inflammatory state immediately reversed. The endothelium, now folks, endothelium is the internal lining of your artery, and that lining is the difference between you and healthy blood flow. If it becomes inflamed, picture a river with a lot of rocks in it, and that flowing water now becomes disturbed and irregular. That's what happens when the endothelium or lining of the artery becomes inflamed. Well, what does that lead to? Blood clots, strokes, and heart attacks. The IV infusions done in this study showed obliteration of inflammation, increase in nitric oxide effect, which soothes the lining of arteries. Studies looking at shingles. Shingles is another reactivation of a virus. You get chickenpox in your youth, it goes to sleep in your nerves, and it comes out again. What makes it come out? Immune system weakening. All you poor souls watching the Red Sox till 3 in. Get your vitamin C dose, right? Your immune system's vulnerable. Now you may have an outbreak of shingles next week. You can blame Evaldi for not winning the game, or JD Martinez. So in the case of shingles, there was a study that found using intravenous vitamin C reduced the intensity of symptoms, reduced pain, reduced the vesicle eruption in the skin, and had no side effect. Versus the immunization for shingles. You know, Shannon, shingles is on an increase lately. And the question becomes, why is shingles increasing? And you know, one of the theories is that we're immunizing children against chickenpox. Consequently, there's less re-exposure. A kid has chickenpox, goes to visit you, coughs, you get re-exposed. You don't get the shingles, but your immune system may respond to that exposure by boosting your immunity against varicella, the virus that causes shingles. So this, ironically, a side effect of herd immunity might be herd vulnerability. And now we become more dependent on more and more immunizations to protect us against relapse. This immunization for shingles, I'm not fond of it. People have said to me, should I get the shingles immunization? Here's the problem with it. Yes, shingles is common. But let's say, okay, I'm 59, I get the shot today. How long is it going to last? A few years? I expect to live to be 120. That's my game plan anyhow, Shannon. Hope you're prepared for that. 120, right? It's my game plan. Well, suppose I get it now at 59. Do I need to get it again and again and again? You know, in one study, they found that the immunization for shingles led to a 40% risk of flu-like symptoms that would put you out of action for up to 3 days. 3 days! That's a lot of life to lose for a shot that may not work when you need it, for an illness that may not come, for an illness that has other potential mediators. One of the reasons that I don't get my shingles shot is because I want to know if my immune system ain't working. And how do you know? If you get shingles, your immune system's a problem. So that's a quick take on shingles. But when we come back, we're going to be talking more about how to keep yourself alive, vital, and healthy. We're going to be talking a little bit more about immunologic senescence and keeping an aging immune system percolating. I'm Dr. Steve Petteruti. This is Intellectual Medicine, and we'll be back.
So,
Before you go, can you hear me?
Yes, I can hear you.
You got a call. A woman caught the back end of Dr. Lowell's interview and just wanted to know if you could repeat what he said about zinc.
Sure, I'll repeat the zinc. Zinc and omega-7 we need to talk about too, because we had a call last week about that.
Joe said, what are the chances of I'm120 opening their own hospital? He said, if I hit Powerball tonight, I'll buy you the hospital.
So Joe's awesome. So IM120, the IM120 hospital, right? What would it look like?
It's like
What
our
would it
center.
look like?
Like our center, but like huge.
Yeah,
It'd
we
be
have,
all
you know, here's the thing. Hospitals are toxic to your health. They have horrible bugs streaming through them. They have doctors who have disregard for your sleep-wake cycle. You go in an intensive care unit, it's going to kill you. Beepers going every place, right? People rushing in and out. Nurses coming in, banging into your bed at 3 in the morning just to check you out. It's horrible. You can't get healthy there. Then they tie you down. Then they lay you down. They lay you down. So our hospital, here's what's going to have, Joe. It's going to have a solarium, an open-air solarium. Light everywhere. If it's wintertime, it'll be like a heated greenhouse type of thing. And patients will be forced to get out of bed and move around. And you're going to have a private room. None of this nonsense, right? Sitting next to some dude hacking up his lung all night long when you're trying to get some rest. That's not happening in IM 120 Hospital, Inc.
Oh, how about the food?
Food's going to be
gosh.
killer. No more of these artery clogger crap.
No.
You're going to get
Smoothies
organic,
and,
healthy food.
Yep.
That's going to be awesome. And so physical activity, you're going to be, we're going to compel you to have a family member with you all the time. You know, the best guardian against awful adverse effect is somebody who knows you standing at the bedside. So you can have someone room in with you, right? Not just mothers and children, but you can have a friend, your girlfriend, your wife, anybody just come in and bunk in right there. That's what we're going to do. Everybody's getting vitamin C.
Everyone, massage therapists, everyone you should be getting
Reiki
massages
every day. You're going
and
to come
Reiki.
in. It's going to be total healing. Be a combination spa/hospital. It's going to be so damn nice. People will want to get sick to get in. There should be choices.
There should be choices.
So omega-7.
Good show going on.
Hey,
Do people overuse antibiotic, that hand soap? My
yeah.
wife is complaining her hands are dry. I said, you're always using that. You're washing your hands with alcohol half the time.
Yeah, and it's not been shown to be effective against a lot of bacteria.
The old-fashioned soap and water, washing your hands that way is better.
Yeah, soap and water. You look at the hospital beds, it's soap and water outside of them.
Yep, it's true.
Hey gang, we're back. It's Dr. Petteruti at Intellectual Medicine here along with Shannon. We are planning the Intellectual Medicine Hospital grand opening. Although really the notion of a hospital is a little bit of antithesis to what we stand for.
It is, but I mean, sometimes it's there for a reason.
No, it's true.
Right?
They got
It'll be small. It's not going to be a big hospital.
It'll be a small hospital. We'll have like Reiki and massage, and we'll have IV vitamin C and organic food.
I like your solarium.
Yeah, the solarium will be all glass-covered solarium. So what happens? You go to the hospital. First, they tie you down like Gulliver. They strap you into the bed. Nothing worse for your health than being made idle and inactive. Then they put beepers all over the place. You can't get 10 minutes of sleep without something buzzing, without somebody coming in your room, banging the bed. The intensive care units are disrespectful of the human organisms that require light, right? Put a damn window in the place. How'd you like to be locked into a room with no window for 72 hours? No wonder why you get ICU psychosis, where people go nuts when they're in the intensive care unit. They tie you down. You want to hold people down, they'll have a panic attack. I'm getting one just thinking about it. Shannon, if I'm ever in an ICU, you have my permission to kidnap me.
I'll break you out.
Thank you.
Be good.
Thank you. And then you lose all control, right? We were just talking to some people staying up late watching the Red Sox. This idea of immunologic senescence, the immune system gets weak as you get old. Well, there are things you can do to counteract that. One of those is healthy eating. You got to have, folks, at least 3 healthy meals to keep immune system functioning. The other one is physical activity. Now, Dr. Lowe didn't get a chance to expand on his research in this area, but the idea, and we've validated this through intellectual medicine research, physical activity is immune health enhancing. So get up, do what you can, move how you can, even if it hurts. And then have your zinc ready. Have your 50 milligrams, that's 50. 50 milligrams, by the way, folks, is recommended safe for short-term use. I do not recommend you stay on that indefinitely without guidance from a healthcare specialist, a knowledgeable chiropractor, naturopath, or some allopathic and osteopathic doctors have this knowledge as well. Certainly Dr. Michael Souza possesses it. He's expert in combining Western medicine with a lot of nutraceutical support. So your 50 milligrams started early at the early sign of your symptom. We recommend combining it with 2,000 milligrams of vitamin C twice a day. So thank you to the caller that wanted to know about the zinc, just heard the tail end of it. And also thank you to the caller that called last week. We were talking, Shan, about omega-3s, about their benefit in a host of conditions, including its merit regarding inflammation, reduction of inflammation. There are studies correlating improvement in psychological conditions, including attention deficit and bipolar. People have been noted to have some benefit with omega-3. So the question came up, what about omega-7? And omega-7 is another long-chain fatty acid. It's found in fish and fish product. Certainly, if you're taking a fish oil-based omega-3 product, it likely has omega-7 already built into it. The omega-7s are correlated with some studies showing benefit regarding inflammation and improvement in cardiovascular markers, including improvement in cholesterol markers. But there's a caveat. If you take an omega-7 specific product, it's really hard to make that product, and it oftentimes will have other fatty acids commingled in it that aren't quite good for the health. So you have to know your source. I don't recommend taking a separate omega-7 product. At some point, you're going to develop what we call swallow fatigue. You can only take so many supplements. And they all sound so good. And when you start reading about them, they sound better. And then the next thing you know, you're ordering them because you want a healthy brain, you want a healthy heart. Maybe I should take omega-3. What about omega-6? Maybe I'll take them both. Great. Well, what about, fill in the blood, a beta-glucan drug or supplement? That's worth taking. Magnesium, multivitamin. Point is that the supplements, we believe in their value at Intellectual Medicine. We also believe that you want to have them personally profiled. So here's a query I get a lot, Shannon, and here's a question, folks. This is an existential medical question. Why are you on so many drugs, and why can't you get off them? How many times have you seen in your experience in medicine, Shannon, somebody come in and their list of drugs goes into double digits? Incredible. There's a certain commodity of exchange in medicine. You go to see your doctor, and your doctor wants to affect your health in some manner. Most doctors are very knowledgeable about drugs, but their fund of knowledge kind of ends there. And their capacity to make recommendations beyond that is really compressed for a couple of reasons. One, they haven't dedicated themselves to study the field of nutritional health in many cases. Two, they don't have time, even if they have the fund of knowledge. Or, and this is the most horrible one of all, there's a potential negative consequence if they're talking about non-drug therapy. You can be accused by your colleagues of practicing non-standard care. If you come in with a flu symptom and you're recommended to take zinc or vitamin C, you run the risk of being reported by your colleagues who don't know anything about it for practicing charlatan-esque care. That is desperately sad. And that encroaches on intellectual freedom of thought and speech. So you've got to find your own way forward. And part of that, folks, is through your own research. It is through the internet. Just mind the sources. If somebody's selling something on the internet and giving you information about that which they sell, you should validate that with independent sources. That is another source or reference that has nothing to gain other than sharing information. At Intellectual Medicine, we like to consider ourselves a stimulus of conversation and thought. We have our recommendations. We stand by them based upon our research, and we encourage you to do your own research and validate all of what we speak. So for omega-7s, I don't recommend them as a separate supplement. I do recommend for many of our patients a high-quality fish oil, emphasis on high quality. Make sure it's fresh. Make sure you keep it refrigerated because it will go rancid on you. So small quantities, 1 grams up to 3 grams a day, correlates with some benefit. So Get your flu shots if you choose, and if you choose not to, keep your immune system pumping. And the way you do that is by some of those other things that we highlighted, including a nice high-quality beta-glucan, and medicinal mushrooms can have some merit with immune function enhancement. Coriolis is one that we often recommend. There have been studies showing its support of immune function. And when it comes to cancer prevention and recovering from cancer, immune function is central to the long-term health and benefit. Thanks to Dan sent in an article, Shannon. Many of our listeners and many of our patients are kind enough to share with us the research they themselves discover, and it's good to have things validate what we've already been reporting, and that is that 40% of cancers now have been associated with adiposity and excess obesity. 40%. If you're a non-smoker and you carry excess weight, it represents your number one cancer risk. So we talk about immune function, and excess adiposity can create inflammation in the body that can weaken immune function. Well, how do you know if your body's inflamed? How do you know? Here are some tells that you can consider. Your gut's not working right. If you're having problems with bloating, with loose stool, with irregular bowel movements, with constipation, you likely are suffering with a degree of leaky gut that can create inflammation. That's when the membranes of the lining of your colon have little cracks in their tight junctions, and it allows partially digested food to get in the bloodstream. That ain't good, because that creates an immune response from the body, an autoimmune reaction. How else can you tell you've got chronic inflammation? Skin rashes. If you have psoriasis and other skin conditions, a hunt for inflammatory triggers should be pursued. We're not talking about drugs. Prednisone will obliterate your immune response and take inflammation away, but it does so at an extraordinarily high cost to your immune function, inviting an opportunity for bugs and infections to hit. So the inflammation you could tell based on symptom. How about chronic wheezing or asthmatic symptoms? That's inflammatory. People with bowel disease, inflammatory. At Intellectual Medicine, we are helping guide you towards your best days, you being the best version of yourself. Every week we're here talking about how to build the foundation that projects you to your longest lifespan. We'll be back again next week. Until then, I'm Dr. Steve Petteruti along with Shannon, wishing you 120 youthful years.
Really quick, Lisa asked, can
Yeah.
you take medicinal mushrooms if you have a mold allergy?
Yes, you can. The mold is different than the extract of the mushroom. The medicinal mushrooms are not mushrooms, but they are taking the beta-glucan portions of the mushroom and having them extracted. Now, how they extract it is important. The best extractions are through hot water extractions. They're more expensive process. Those will cost a little more. The alcohol extracted products are weaker. So you do want to know the source about where it's extracted. And then you want to consider the value of it in your personal circumstance. If you're fighting a malignancy, if you've got immunologic weaknesses, then we strongly advocate them. If you're advanced in age, they may have more merit than if you're younger. If you're below the age of 50 and in good health, you don't need the medicinal mushrooms. Stick with, what's that mushroom everybody likes? Portobello.
Portobello.
That's right, portobello. Oh, we're still, oh yeah, that's right. Well, guys, thanks for tuning in again. I hope you enjoyed the summary of Dr. David Lowe's conversation. And thanks, Joe, for offering to sponsor the hospital. Once you win the lottery, we'll be looking forward to that. See you next time.